Hello, my name is Lynn Lee, and I am giving a presentation on substance abuse and addiction. So, drug abuse and addiction is very rampant in the US, specifically in Oregon, where I currently reside. The state was ranked number 1 for marijuana use and pain reliever abuse in 2017. It ranked second in methamphetamine use and fourth in cocaine use. To combat this problem, the state is spending upwards of $6.7 billion annually. Unfortunately, only 1% of said budget is for prevention and treatment. The other 99% are for social ramifications, such as rehoming neglected kids, prison costs, health costs, and car accidents. On average, that spending totals about $1,482 per Oregonian per year, with a population of 332,000 addicts. Every day, about 7 people in Oregon will die from addiction. So, what is the government doing? Well, the Drug Addiction Treatment and Recovery Act of 2020 was passed. It's also known as Measure 110, and is the first attempt in the entire nation to decriminalize the personal possession of illegal drugs in smaller amounts. This means that what used to be a felony is now a misdemeanor with more generous fines. It will also use marijuana sale tax to fund treatment and recovery programs, create an addiction hotline, and a council to oversee program grants. Of course, this is a very positive first attempt to reduce the stigma and negative connotations associated with addiction. And it leans more towards the social medical model and more in line with health promotion values versus the prior criminal justice system. Of course, there are problems with Measures 110. For example, the rapid influx of patients into the ill-equipped facilities will lead to the mass exodus of workers as the staff become more burned out from excessive patients load. Measures 110 also removed the prison system pathway. Even though it wasn't perfect, this pathway helped many addicts recover thanks to that rude awakening of being in prison. So this forced treatments to be an option with threats of financial penalty and $100 fines. And this fine is very misguided because it forces the responsibility on the individual here, and it targets a very small problematic minority instead of addressing the issue of the rampant misuse and overprescription of drugs and opioids. And so it has misguided intentions and penalties. And this $100 fine is a big problem for homeless population, but is just a slap to the wrist for the middle class and the working individuals. So 110 was adopted from the Portugal reform system, but it failed in that the Portugal government spent 2 years to craft a new system to replace their jails, their judges, and their lawyers with compassionate doctors, social workers, and addiction specialists to aim to help rather than punish, which is the ultimate goal here. So how are we going to fix the issues that Measure 110 is bringing about? So first, there will be a healthy prison approach to elevate the pressure on the current system. It will funnel a small percentage of the worst offenders into the justice system, where they'll be confined, but will be prioritized for their health and where addiction recovery can start at. The prison staff will be trained to adopt a healthy prison mentality and to promote a healthy living in the prison system and when they're released to the outside world. Hopefully, networks of addiction centers, experts, and professionals will be built in the 2 to 5 years time frame while the prison system is being reformed. So a combination of both will enhance cultural and racial competency for certain minority groups with the health in all policies approach. And then there will be paced diversion of offenders from the criminal system into the social medical system as the supply can meet the demand. Finally, data should be gathered over a long period of time to see if the program is working effectively. There should be collaboration with other organizations and continued priority in addiction as an issue. And these all implement features of the social determinants of health into policy making, and it will be a framework of health promotion in this approach. And here are the words that were cited in the making of this presentation.